Hi, my name is Alessandro Devigus and I'm a Swiss dentist with a passion for new technologies. This is the space where we explore the latest trends and how to react to them in the smartest way, because that's what everybody does. Welcome back to a new episode. I've been running my own dental practice for many years, and while today I talk a lot about new technologies and trends, let me share something personal with you. When I started out, I was completely focused on doing perfect dentistry. I could prep a crown, place an inlay, manage even CEREC 1 complex procedures after a short time. But when a patient asked a tricky question or reacted emotionally, oops, I froze. I didn't know how to react, how to respond without feeling awkward or defensive. No one taught us that at dental school. And honestly, in the beginning, I thought they had the problem, too demanding, too nervous. But over time, I learned that the real gap was in my skills. Communication wasn't optional. It was the missing link to becoming not just a better dentist, but also a better person. That's why today, in this space, we don't just talk about the latest trends. We explore how we, as dentists, can react to them and to our patients in the smartest, most human way possible. How should we talk to our patients? Why is communication so important? Statistics from recent research show what we all feel in our practices. Poor communication is one of the top reasons patients switch dentists. And it's not about the dentistry, it's about how we make them feel. Effective communication is not a nice to have, it's the foundation of quality care, as highlighted by Ho et al. In their 2024 review. So this is also the basic of what we are talking about today. Without it, patients may misunderstand their diagnosis, feel unsupported, and even worse, become more anxious about their visits. And here's hard truth from the literature. Many of us overestimate our communication skills. We think we are clear, but patients often leave confused, unheard, or anxious. We tell them what they should do, but they don't understand why they should care. Why effective communication changes everything, according to Ho et al. Again, this is an interesting article. Communication in dentistry is bidirectional, patient-centered, and should follow the 5 C's. Clear, correct, concise, complete, and cohesive. When we get this right, we see fewer misunderstandings, fewer no-shows, better adherence, and yes, happier patients who trust us. But it's more than outcomes. It's about the human experience we create in every appointment. Patients who feel listened to, understood, and involved in decisions are more likely to accept treatment, return for care, and refer others. Essential communication skills you can start using today. Let's break it down into things you can apply immediately in your practice. Active listening. Give your full attention, let the patient speak without rushing, and use open-ended questions like, tell me how you feel about this. As Ho et al. Suggest, it's about understanding the patient behind the teeth. Use clear, simple language. Avoid dental jargon. Say germ instead of bacteria. Remember, what's crystal clear to us is often confusing to patients. Nonverbal communication, very important. Smile, make eye contact, lean forward. Use open body language. As the research shows, your body speaks louder than your words. Provide also visual aids. From digital scans to interactive apps, showing is often more powerful than telling. And this is something you might have heard already. Show, tell, do. Empathy first. Ho et al. Emphasize the power of empathy. A simple I know many patients feel nervous. Let's take this step by step can transform the entire experience. Give your patients time. Rushing creates barriers. Slowing down, even during busy days, open doors to better conversations and trust. It's always, if I run out of time, I say, now let's slow down. And you will see you get to the end much faster. Tools that can help you communicate better. Patient communication apps can streamline your workflow and keep patients engaged even between visits. So the 24/7 hour open office is not a dream or an illusion anymore. Text messaging still leads the way with open rates over 90%, far outperforming email. Everybody has the smartphone at hand and watches when the message is popping up. Teleconsultations and messaging apps allow for quick check-ins, follow-ups, reassurance, especially valuable for anxious or complex cases. The learning curve. My reflection after 30 years, I'll be honest, even after all these years, I still sometimes catch myself thinking, I could have said that better. And that's okay. Communication is not something we master once. It's a skill we refine for life, and we can still improve. But here, what I can tell you from my own journey. When I started truly listening, when I started asking instead of telling, my patients felt the difference. They trusted me more, they were more open, and I became not just their dentist, but their partner in health. That's what I want for you too. So how can we move forward together? So what's your one step today? Maybe it's asking more open-ended questions. Maybe it's reviewing your consent form to make them clearer. Or maybe it's simply asking your next patients how you feel about this plan. Small changes create big impacts, because when we communicate better, we don't just do better dentistry, we create better human connections. Thanks for watching, and as always, see you in the next episode where we continue to explore how we can be better together.